Non-estrogen hormonal and non-hormonal family planning methods are generally considered safe for breastfeeding mothers. Estrogen-containing contraceptives, like the combination pill, patch, or ring, should be avoided, especially in the first 6 weeks postpartum, as they can decrease milk supply. Choosing a family planning method depends on your personal preferences, health, and family goals. Consulting with a doctor or lactation specialist is recommended. Short-acting hormonal methods. These methods release only the hormone progestin, which does not negatively affect milk supply. The mini pill, progestin-only pill. How it works. A daily oral pill containing only progestin. Pros. Can be started immediately after childbirth and is effective when taken consistently. Cons. Must be taken at the exact same time every day to be effective, which can be challenging for new parents. Contraceptive injection, Depo-Provera. How it works. A progestin-only shot given every 3 months. Pros. Highly effective and low maintenance. It can be started 6 weeks after delivery. Cons. You may experience side effects like weight gain or mood changes. The effects are irreversible for the duration of the injection, so if you experience side effects, they cannot be stopped. Long-acting reversible contraceptives, LARCs. These are highly effective low-maintenance options that can be easily removed when you decide to become pregnant again. Hormonal IUD. How it works. An intrauterine device, IUD, that releases a small amount of progestin directly into the uterus. Pros. More than 99% effective and lasts for several years. Many studies show no negative impact on milk supply. Cons. Rare cases of decreased milk production have been reported. There is a very low risk of uterine perforation during insertion, which is slightly higher for breastfeeding mothers. Contraceptive implant. How it works. A small, flexible rod inserted under the skin of the upper arm that releases progestin. Pros. Over 99% effective and provides protection for up to 3 years. Safe for breastfeeding mothers and does not affect milk production. Copper IUD. How it works. A non-hormonal IUD wrapped in copper that is toxic to sperm. Pros. More than 99% effective and lasts for up to 10 to 12 years. It does not contain any hormones that could affect your milk supply. Cons. Some women experience heavier menstrual bleeding and cramping, especially in the first few months. Non-hormonal and natural methods. These options have no effect on your breast milk and can be used immediately after childbirth. Condoms. How it works. A barrier method that blocks sperm from entering the uterus. Pros. Widely available, protects against sexually transmitted infections, STIs, and has no hormonal side effects. Cons. Effectiveness is lower with typical use compared to LARCs and requires use with every sexual encounter. Lactational amenorrhea method, LAM. How it works. A temporary method relying on the natural infertility that occurs with exclusive breastfeeding. Pros. Highly effective for the first 6 months if specific conditions are met. Cons. For LAM to be effective, you must exclusively breastfeed, have no menstrual period since giving birth, and your baby must be less than 6 months old. If any of these conditions change, its effectiveness decreases significantly. Sterilization. How it works. A permanent option for those certain they do not want more children, involving tubal ligation for women or a vasectomy for men. Pros. A one-time procedure with very high effectiveness. Cons. Not easily reversible. What about combined hormonal methods? You should typically wait 6 months after childbirth and until your milk supply is well established before considering any birth control containing estrogen, such as the combined pill, patch, or ring.